I am presenting an article called Follow-Up Services After an Emergency Department Visit for Substance Abuse. Patients with substance use disorders represent a disproportionate sector of ED users. This is due to lack of routine screening, lack of early intervention and identification, and lack of follow-up. This retrospective claims analysis studied ED users with a diagnosis of substance abuse in 2004. Objectives of this study included to determine the extent of follow-up care after an ED visit, to determine factors that might predict follow-up, and to determine groups that do not receive adequate follow-up. The findings were as follows. 1.9% of ED users were diagnosed with a substance use disorder. Only 16% of these patients receive follow-up services for their substance abuse within the next 60 days. 17.4% of patients had a second ED visit within the next 60 days after their first. This shows that they are disproportionate ER users. Barriers to screening and follow-up included patient confidentiality, time constraints in the ER, and the fact that screening threatened reimbursement. Groups in which follow-up was lacking included patients with a primary medical diagnosis as opposed to a primary mental health diagnosis, and also patients aged 20 to 29. However, the study did emphasize that a significant number of ED users with substance use disorders were engaged in their follow-up. Therefore, these results could help target specific populations for quality improvement interventions. It should also help better prioritize ED resources, reduce substance use, and limit ED overuse by people with substance use disorders. As gateways to healthcare, emergency departments are ideal sites for early identification of drug and alcohol users, brief intervention, and subsequent follow-up.